Good evening, Transformers. It's Caroline here with Milton Coaching Collective. It's Thursday night, which means we're chatting about all things health and wellness, especially how you can start to make small shifts in your life, in your habits, to improve your energy and to fend off burnout. I'm here tonight with a guest I'm so excited for you all to meet. If you're not already familiar with her, she is based in the Kansas City metro area, but you can find her across the internet, spewing truth, changing the way that we're thinking about our health, our nutrition, how we are just interacting with our bodies on a daily basis. Her name is Dr. Leigh Wagner, and she not only is a registered dietitian, she also practices functional medicine, among many other credentials, but I really wanted to highlight those two because they are areas of expertise that I think you as the viewer will find to be especially helpful as we're diving into the topic tonight of root cause analysis. So Dr. Wagner, thanks so much for being here. It's such a pleasure.
Yeah. Oh, it's so fun to be here with you, and I'm excited to chat. I bet we could talk for a lot longer than 30 minutes. So.
Absolutely. And we'll try to be concise. If you have any questions watching live, or if you're watching a replay, please drop them on this video. I'll make sure we get you an answer, either directly in the conversation or after the fact. But Dr. Wagner or Dr. Leigh.
Call me Leigh, please.
Okay.
Leigh.
Okay.
Yeah.
No need for formalities tonight.
Not at all.
I'd love for you to share with us the problems that you solve in your practice and really what led you into that space. What was the motivation or the passion behind finding your way into the areas in which you operate?
Mm-hmm. Well, I will save the long story for how I got to where I'm at for another time, but really who I work with primarily now are mostly women. I do have some guys that I work with, and they're really fun and I enjoy that, but definitely mostly women who are exhausted and often are dealing with hormone related issues, which definitely can tie in with the exhaustion, whether it's irregular periods or really severe hormonal fluctuations or PMS, or even that just perimenopausal range where we're kind of transitioning. And then also a lot of digestive related issues. It's IBS or different forms of inflammatory bowel conditions, reflux, like you name it, anything involving the digestive tract from top to bottom. I help people through nutrition to help really try to figure out how they best can use nutrition to improve their health, but also while maintaining a healthy relationship with food, or maybe developing a healthy relationship with food if they feel afraid of, or if their only background has been a lot of dieting, chronic dieting. So I like the interplay of using the functional healthcare background that I have, as well as kind of the tools of intuitive eating and just making sure that we're not perpetuating unhealthy eating behaviors, so that we don't have to be so fearful around food, because I think that I've seen occur a lot.
Yeah, absolutely. Something you mentioned that really just sat with me is that so often our hormonal symptoms we accept as being normal. And I don't know how it was for you growing up, but in the early 2000s, when I was having my first menstrual cycle and really transitioning into being a hormonal woman, right? There wasn't a lot of conversation around what's the difference between what's normal and what is appropriate or right for your body to do, right? So it's normal for women to have PMS symptoms, but that necessarily does not indicate that your body is operating as it should be, or that your hormones are in balance. And so something that is normal might not be, might still be an indication of something that is not quite right with our body and with our hormones.
And hormones fluctuate, especially for women. They're fluctuating throughout the whole cycle, the whole month, and that kind of varies in length. So that is normal, but how much they vary and if they're staying in balance with each other, like with progesterone, estrogen, even testosterone, because we have that too. But that I think one major misconception is that our periods are miserable and they should knock us out and we should have to take, Advil or whatever for 3 days. That's not normal. It is normal to have a little bit of cramping and pain, but it really shouldn't be what we have accepted as normal and exhausting, essentially.
Yeah. Perhaps a better way of putting it is that what's common isn't necessarily normal.
Yeah.
Well,
go ahead.
I was just going to say hormones have been something that has been really interesting to me as of late, especially factoring in like how to really leverage hormonal health for your productivity in the workplace, and just acknowledging that for women going through major hormonal shifts so frequently in our lives, in contrast to our male-born counterparts who really go through just a small number of major hormonal transitions in their lifetime. And so, thinking about that and how it can allow us to work differently, and really understand how to approach our bodies and the health of our bodies through hormonal support as a means to productivity and as a means to creativity.
And as a means to rest.
Yeah.
There are times where it's appropriate to really just give yourself that rest time when your brain isn't going to be quite as on and focused when our hormones are at their lowest. So we can kind of ride that wave. I know that can be hard, especially in American culture, but really you're right. You can leverage the times where we can be kind of most creative and productive and the times where we're kind of having a lull. And I love that part of the work too. I think it's also really fun and interesting to get in touch and in tune with the fluctuations in energy and how those can be related to our cycle. Whereas a lot of times I find people want to blame it on food, like, maybe it was something that I ate, when absolutely our diet has a huge impact on our overall health and our focus and inflammation and all kinds of things, but it's not causing every ill that we have. And I think parsing out that is really important.
Absolutely. And I was having a conversation with my father the other night about women in the workplace and how women tend to have so much piled on them. And he was asking me for some reasons behind that, like why is this happening so much to women in the workplace? And one of the things that I brought up is that we adapt this mindset that if I don't do it, it won't get done, right? And the importance of rest for our bodies cannot be underscored enough. Right? And that really requires a huge mindset shift to be able to say, if I don't do it, it will get done if it is important enough, right? Like I can release that.
Yes, that is true. So true.
So tell us rather, what's the different approach that you feel like you as an RD take with clients that maybe is a misconception of what people think of with a relationship with an RD, or from what maybe other RDs are doing in that same space?
I will say for sure, if you're talking about like generally dietitians, the integrative approach is a little bit different in that an integrative and functional approach is a little different in that we really focus on the roots of the problem and keep continuing to ask why something is going on and trying to dig in and really knowing what's nutrition and what's not. I think, again, that's a hugely important distinction in the age of wanting to blame everything on our diet. which, I mean, as a dietitian, I would like to think that diet is like the only thing that impacts things, but it's certainly not. So that would be a distinction from kind of broadly. I think there is definitely a stereotype that dietitians just preach the food guide pyramid, which now is the plate. And in certain instances, that is what some dietitians do, because many are working in broad populations and not one-on-one with individuals. I've really only worked with individuals outside of doing cooking classes, which is a great way to teach people how to do what we talk about all the time in cooking whole foods. And then I think within the integrative and functional realm, I have kind of a little bit different take on that intuitive eating and that healthy relationship with food, which is, I've just found over 11 years of practice, is just so critical to have as part of the foundation. Because if we're really wanting people to be healthy long term, we have to make sure that they're set up to be self-sufficient and not kind of be in this constant battle or chronic, be set up for chronic dieting.
Oh man, I feel like I want to tackle both of those things at the same time. But you talked about the root cause analysis, and as an engineer by training, I was raised on root cause analysis, right? So the 5 why, asking the question until we can't ask the question why again, and then we found our root cause. And I find myself with clients in my coaching practice of really loving the process of the root cause analysis and the willingness to get curious about our bodies and what might be rooting us in our habits or in our preferences, because we find that, like you said, it really has much less to do with food. Food plays a role, but there's so much more to dig into. So take us through maybe an example of root cause analysis or your methodology with finding these root causes with clients and what that means for the client once that root cause has been found.
Well, it's going to be something different. I mean, there are things that will be common among people. Like if we're living in the US and we're eating like a standard American diet, we're probably going to be eating very few fruits and vegetables. That's what the evidence tells us. A lot of highly processed food, ultra processed food is what the term is in the literature right now, which, isn't a very healthful way of eating. So when I talk about or try to explain looking in the roots to people, I give the analogy of a tree, because that's when we talk about a plant, the roots, and then if we're talking about a tree, you have the leaves and the branches. So in conventional medicine, which I was trained under a conventional model, I'm a registered dietitian. We are under the medical doctors in the hierarchy. And conventional medicine is very good at focusing on the leaves and the branches of the tree. And that's really identifying the what, like diagnosing the signs, the symptoms. So if you have high blood pressure, high blood sugar, migraines, whatever it might be, we can give a medication, we can do a procedure, we can give chemotherapy, like whatever the medical intervention is to treat the symptom or treat the disease. And then I'm sure you know where this is going, but I'm focused on the roots in the soil. So that's where we're looking at what you're eating, how you're moving, your stressors, your environment, your community, your genetics and family history, your nutritional status, your gut. All of those things are going to play a role in what the tree looks like above ground. And so they're both really important. It's not that one is more important than the other. You need both. I think we need both. I would love for us to focus more in the roots in the soil, because that's the long-term game, unless we're going to be chronically on medications. We're growing our medication list. And so looking in the roots, that's why it looks a little different for different people, because some people really need to focus on, the other part of it is that dynamic between the individual and the practitioner or the coach or whoever it is, where you really have to develop that relationship. And so what I see as the most obvious root cause, let's say like alcohol or a highly refined diet or
Mhm.
sleep and stress. And like, I think those are the most important, but if that person
Mhm.
isn't ready to make those changes, then it doesn't really matter. So
Right.
I'll share and teach and educate on that. But it really is most important what that person is ready for. And then we can kind of inch as we build rapport. And really, my goal is to help them feel a little bit or a lot better as fast as I can so that they have more energy to dig a little deeper, do a little bit more. So some of that involves like lab testing. So I might do, functional lab testing or using conventional labs and looking at the lab results through a more nutrition focused lens, because your
Mhm.
doctor is looking at it from a medical lens, and as a dietitian or nutritionist, I can look at it through more of a nutritional lens. So in the roots in the soil, it really varies based on what that assessment is. It starts with
Mhm.
an assessment, a really, really
Mhm.
thorough assessment. So asking a lot of questions, asking them to fill out a really comprehensive form. And then the things that are kind of blinking red are the areas I'll identify first and then kind of assess what they're ready for.
Yeah.
So sometimes it can be correcting deficiencies. Sometimes it can be really focusing on digesting their food better. If they're bloated after every time they eat, or if they're getting reflux, we can't do a whole lot of, well, yeah. So I guess I try to help make the biggest impact with the smallest amount of effort, um, so that we can kind of build momentum moving forward.
Yeah. Yeah. Hey, we've talked a little bit in the past about the importance of having lab work done, and I know folks in the group have asked for where can I get more comprehensive labs performed so that I can have a better understanding of deficiencies and areas that might be contributing to some of the issues that I'm experiencing on a day in and day out basis. And it really is so helpful to do. And, that's not within my scope of practice, but for for individuals to be able to have that information and to have someone explain it, right? To
Mhm.
really explain, okay, how does selenium impact your health? What might that mean if we need to incorporate more selenium into the diet? Really, what does it mean to be vitamin D deficient, right? So many of us hear that, and we don't really have a full scope or understanding about how the processes of the body, how those energetic processes in our body are being impacted by low levels of vitamin D. And to have a professional take you through it can be so enlightening. And you can leave with, an armful of supplements and wonder, is this any better than an armful of medications? But,
Mhm.
the answer is that you have some answers and you have a
Yeah.
better understanding of what uniquely your body needs, right?
Yep. Exactly. And you can use the supplements as you're also making the dietary changes too.
Mm-hmm.
So, and yeah, so I guess you're totally right, and that is definitely something that I'd love to see shift is, where are we swapping just medications for a bunch of supplements?
Right.
But when you have that information, and I would really encourage people to, if you're going, because there are outlets where you can just like get your own testing done, but
Mm-hmm.
then people don't know what to do with them. So like,
Right.
people are messaging me in Instagram asking me to interpret labs. I'm like, well, I'm not really your provider and I didn't order those labs.
Right.
I don't know what's going on with you. So it is important to have a professional who is trained and knows the nuance of that. And even I was talking with some colleagues yesterday about the idea that like obsession with optimal
Mm.
ranges of labs, which is important. Like, if
Yeah.
B12, the range of normal is 200 to 1100, that's a really wide range. And if somebody's
Mm.
at 250, they absolutely are deficient, even though they're
Right.
not 150.
Mm-hmm.
So that is important to have optimal ranges, but at the same time, optimal, the lab work is just part of the assessment. It's not
Mhm.
everything. We're not just looking at the labs, we're looking at the person and assessing them clinically too.
Yeah, I again, I love to take the approach of, treating your body as an experiment, as a loving experiment. We're not
Mm-hmm.
being reckless with our bodies, but we're getting curious, right? We're asking the questions about, does this feel normal or not? Should I dig into why this might feel abnormal? Should I question why I'm constantly having this digestive issue? Should I question what might be contributing to that? I had a really interesting example personally, in that for the first time, my husband decided to take out gluten and dairy from his diet just to evaluate how his body responded to that. And when he incorporated them back in following these 3 weeks of of evaluating his body, he almost instantly experienced an episode of his Meniere's disease.
Mm.
And so as he dug into the research that's been done on this, he was finding studies that showed that removing gluten or dairy from the diet can help with those symptoms, and then reintroduction can cause episodes. So, this was not something that was ever necessarily discussed in care visits for him to be looking at his diet. And he almost kind of stumbled upon it out of curiosity of, how would it impact my digestion? How would it impact my athletic performance? How would it impact my sleep
Mm.
if I were to compare and contrast what my body feels like today with what my body feels like tomorrow, with and without? And so that was just really remarkable to say, okay, this might be a contributing factor.
Yeah.
Is it a root cause? That's not for us to say, because we're not the professionals that are, studying day in and day out these diseases. But that was just really enlightening for us as a family.
Mm-hmm. Yeah. And I was going to say this too earlier when you're talking about selenium and vitamin D and now gluten and dairy. Even the people who study this day in and day out don't know yet.
Mhm.
Like, there's still so many unanswered questions in the realm of nutrition and health and it's really hard to study because it's
Yeah.
not like you're sometimes we are just taking vitamin D, but usually we're doing that and we're changing the way we're eating and we're
Mhm.
exercising and we're trying to sleep more and all of those things. So it as much as I love nutrition and I know it is a science, it's complicated
Yeah.
and messy science.
Yeah. Anything that has to do with the human body is just complicated because
Yeah.
of how diverse genetics are. I guess I should say anything that has to do with genetics is
Mhm.
messy, because
Yeah.
it's just so vast, right? And so so diverse in what each of our individual genetic codes are. Like you said earlier, we could absolutely talk about this all night. But I want to thank you for joining us this evening and really shedding light on this topic. And for those who are tuning in, again, Dr. Wagner, Leigh, as she asked me to refer to her at the top of
Yes.
this segment, um, knows her stuff. And if you're not already connected with her on social media platforms, I encourage you to do so. If you're interested in a relationship, a working relationship with her, please reach out to her as well. You can find her by her website. I'll let you share all of those details,
Okay.
as
Mhm.
well as anything else that might be pertinent for folks to know about you and your practice. But thank you.
Sure. Yeah. So if you want to stay connected, I mostly live on Instagram and it's just at Dr. Leigh Wagner. And then my website is drleighwagner.com. And I'd be happy to chat with you on a discovery call if you're interested in working together. I have a self-paced program called Mind Your Body that people can do kind of on their own that helps people both get in tune with message. I find that that's something that I really help people do, is just really getting familiar with their body and the messages it's sending to us and how food plays into that. And so Mind Your Body is just kind of the basics of that. It's not obviously personalized. That's really what I specialize in, is personalized care. But I think for somebody who's just kind of getting started, or also really wanting to develop a healthy relationship with food, that could be a good place to start too.
Absolutely. Absolutely. Thank you tonight for joining me, Dr. Wagner. I really appreciate it. Thanks everyone else for tuning in, whether you're watching live or watching after the fact. I hope this was helpful to you. If you have any other questions for either myself or for Leigh, please drop them on this video. We'll make sure that we get you some answers. I will not be tuning in next Thursday because I'll be on vacation with my family, but I'll be back the following week on the 15th for a Facebook Live. So tune in 7:30 p.m. Central Standard Time. I hope to see you there. Have a good evening.
Thank you.